Dr. Shido and I spent a year pulling 2,600 papers. We literally pulled every manuscript, every article in the literature, not only here in the US, but also in the UK, the EU, in Australia, because we wanted to gather all of that data to help inform how we would build out this program. And we picked information from outside of the US because actually many other countries are quite a bit ahead of us in terms of how they approach this treatment. In doing that, we uncovered several key themes. The first was that there aren't just one or two, but in fact there are 30 medications that have good data to support their efficacy in treating alcohol use disorder. The next thing that we learned that was really interesting is that there's, most especially in the last 8 years or so, a lot of data coming out about how genetics can help us to determine which of those medications are likely to work best for which patient. Lastly, we learned that nutrient therapy could be a profoundly impactful tool in helping to restore brain health. That compromised brain function actually impairs patients' ability to be successful. So if we can address that nutritional deficiency, we can actually help restore brain function very quickly. So those were all the medical pieces. We also learned a few other additional things. We learned that peer support, for example, can improve patient retention in a program by 300%. We knew that peer support, therefore, would be a really vital and important component of our program, and it really has proven to be true. We've learned from other chronic medical disease management that remote patient monitoring makes a difference. So in this situation, we can use breathalyzers, in-home drug testing. There are ways that we can track how patients are doing over time from home, much like a diabetic at home would do their blood sugars. Or patients with congestive heart failure have a specific kind of scale that they use every day, where the digital information is transferred to the doctor every day. That same model has been implemented here. Lastly, care coordination has a gigantic impact on clinical outcomes. We learned in my first company, Clean Slate, that if we had care coordination at a clinical office, the patient's clinical outcomes were 100% better. So we know that by having a navigator on the team who helps make things a lot easier for patients, coordinates and makes sure they're getting their prescriptions, make sure their primary care doctor is up to date on what's happening in their care, connect with their therapist if they have one, or their psychiatrist if they have one, and keep all of those parties informed and engaged in that patient's treatment, the patient benefits most of all. So each of those different components that I've spoken about, medications, nutrients, remote monitoring, genetics, peer support, and navigation, those are really the constructs upon which this company is based, which again mirrors what we do in chronic disease management.